Hi, we're senior nursing students with Cumberland University. I'm Megan Taylor.
Aleigha Buhler.
And I'm Kelsey Vaught, and this is our poster presentation for research in nursing. The opioid epidemic is a threat to individuals and families across the United States, claiming more than 500,000 American lives since 1993. Recent evidence concludes that 130 Americans lose their lives to opioid overdose every single day. Since the 1990s, opioids began to be steadily prescribed for chronic pain, and studies even suggest that an estimated 80% of heroin users were first prescribed opioids for chronic pain. So what can we do to address the opioid epidemic? Using Roy's adaptation model as a guide as it focuses on the individual as a biophysical adaptive system, we were able to form a PICO question stating, in adults with chronic pain, what is the effect of cannabis on opioid use? To guide our literature review, we used scholarly databases from Google Scholar and Cumberland's Vice Library using key terms such as marijuana, opioid, and chronic pain, along with others that are listed on the poster. During our review, we found 5 peer-reviewed studies to help support our PICO question.
So as Kelsey just mentioned, we found 5 articles that helped us answer the PICO question. In Solar and colleagues, their study linked reduced opioid use with using cannabis in those with chronic pain. Takakawa and Sulak, they found cannabis to be used well as a substitute for opioids with chronic pain. Okusanya et al., their review of opioid doses used in treating chronic pain was actually reduced by 64 to 75% with cannabis. And Ashita and colleagues found 41% of people who responded to their survey also reduced their opioid use with cannabis. Campbell and colleagues looked at dispensary programs and found that with the programs, daily doses of opioids dropped 14.4% annually.
Practice implications are how nurses gain knowledge and gather information from the results table and relate the findings to everyday nursing care. Our results showed that cannabis decreases withdrawal symptoms, decreases side effects, is potentially safer and more effective treatment than opioids. Cannabis improves activities of daily living and reduces the need for opioid analgesics. Some key points to take away are that 21 to 29% of patients who are prescribed opioids misuse them, and 130 Americans die every day from an opioid overdose. We used Roy's adaptation model and concluded that the doses of opioid analgesics are reduced when used in conjunction with medical cannabis, and it produces less side effects and withdrawal symptoms. However, more research is needed to determine the optimal dosage of medical cannabis to be effective in reducing opioid misuse. That concludes our presentation. Thank you for your time.